7,000 steps a day. The surprising health benefits. Imagine taking just 7,000 steps a day to significantly reduce your risk of developing serious health issues like cancer, dementia, and heart disease. Sounds too good to be true? But here's the astonishing part. A recent study published in the Lancet Public Health suggests that this modest daily step count can have a profound impact on our overall health and well-being. But before we dive into the details, let's address the elephant in the room. The age-old notion that we need to take 10,000 steps a day to stay healthy. Where did this magic number come from? And is it really based on scientific evidence? As it turns out, the origins of the 10,000 step goal can be traced back to a 1960s marketing campaign in Japan, where a brand of pedometer called the manpoke, or 10,000 step meter, was launched. And this is the part most people miss. This figure was never meant to be a scientifically backed guideline, but rather a clever marketing ploy that has since become an unofficial benchmark for fitness enthusiasts around the world. But what does the science really say? The Lancet study analyzed data from over 160,000 adults worldwide and found that taking 7,000 steps a day can reduce the risk of cardiovascular disease by 25%, cancer by 6%, dementia by 38%, and depression by 22%. And the best part? These benefits can be achieved even with modest step counts of around 4,000 steps a day, compared to very low activity levels of just 2,000 steps a day. But here's where it gets controversial. Some experts argue that the focus on step counts can be misleading, as it doesn't take into account other forms of physical activity, such as swimming or cycling, that can be just as beneficial for our health. Dr. Melody Ding, the lead author of the study, notes that the current guidelines, which recommend at least 150 minutes of moderate aerobic activity or 75 minutes of vigorous aerobic activity per week, can be difficult for people to understand. However, she suggests that including a step count recommendation as an addition to these guidelines could be a more practical and achievable goal for many people. But what about those who are less active or have chronic health conditions? Should they aim for a lower step count? And are there other forms of physical activity that can be just as beneficial? Dr. Azim Majid, a GP and professor at Imperial College London, suggests that even doing household chores like hoovering or gardening can form part of daily physical activity and have significant health benefits. So what's the takeaway from all this? Is 7,000 steps a day the new magic number? Or is it just a more realistic target for those who are struggling to reach the elusive 10,000 step goal? We'd love to hear your thoughts. Do you think step counts are an effective way to measure physical activity, or are there other factors at play? Share your opinions in the comments below, and let's get the conversation started. And if you're feeling inspired to get moving, why not start with a modest goal of 7,000 steps a day and see how it can transform your health and well-being? The truth about 10,000 steps a day, what science really says. Forget about 10,000 steps a day. Science now has a more precise figure. If you've been told that walking 10,000 steps daily is essential for health, you might be surprised to learn that scientists suspect the number was created to promote pedometers, not based on real data. A recent study published in Lancet Public Health found that the actual number of steps needed to prevent chronic diseases is much lower. The study reviewed decade-long research on steps and health, revealing that even 7,000 steps daily can significantly reduce risks. Walking just 7,000 steps a day lowers the risk of developing more than half a dozen medical conditions and premature death, according to researchers from Australia, the UK, and Norway. They analyzed 160,000 adults, tracking their walking habits. Compared to those taking 2,000 steps, 7,000 steps were linked to a 38% lower risk of dementia, a 25% reduction in heart disease, and 28% fewer falls. Mortality dropped nearly half among 7,000 step walkers. Risks for depression and type 2 diabetes also decreased, though less than for other conditions. This is the first time scientists have linked step goals to such a wide range of preventive health outcomes. Melody Ding, a public health researcher at the University of Sydney and the study's lead author, notes, step counting devices are becoming so widespread that people want to know what they should aim for. She emphasizes confidence in the 7,000 step target. The study is exciting because it shows how step volume impacts major health outcomes, says Michael Rocha, a cardiologist in Dartmouth, Massachusetts, who leads walking excursions in his community. We now have more evidence to change what we tell patients, he adds. Earlier guidelines for Americans and others didn't have enough data to recommend a specific step target, leaving 10,000 steps as a holy grail, despite many people falling short. A 2023 study in JET found that as few as 2,800 steps reduced cardiovascular risk, with the most benefit at 7,200. While 10,000 steps lowers cancer mortality, dementia, and depressive symptoms, the extra 3,000 steps offer minimal gains. Still, 10,000 steps may remain a viable target for more active individuals, the study states. Walking backward? Even better. The researchers reviewed 57 studies involving 35 groups, including older adults, people with chronic conditions, and healthy young adults, most focused on deaths from causes and cardiovascular disease, but other conditions like cancer, type 2 diabetes, cognitive health, mental well-being, and falls were covered in 4 to 6 studies. While the review acknowledges limited data for some conditions, Ding says, as we gather more data, these results may evolve. Walking speed likely plays a role, but the exact impact remains unclear. For physicians, the confirmation that 7,000 steps can prevent dementia is reassuring. Stephanie Towns, a Yale neuropsychologist, explains aerobic exercise improves brain oxygen and nutrient flow and controls risks like hypertension. I recommend brisk walks to reduce dementia risk. How important it is to step count daily. Lace up your shoes and get active. How many steps a day for better health? New study reveals the magic number. Imagine if I told you that you could significantly improve your health and longevity by taking fewer steps each day than you might have thought. Sounds too good to be true, right? But here's where it gets controversial. A recent analysis has challenged the widely accepted 10,000 steps a day recommendation, suggesting that the lower number might be just as beneficial. Let's dive into the details and see what this means for your daily routine. Sarah Manusco, a seasoned health and lifestyle reporter at CBSNews.com, has been covering the latest findings in health and wellness. Her journey includes a stint at USA Today, where she played a pivotal role in launching the newspaper's wellness vertical. Now, she brings her expertise to CBS News' Health Watch, keeping us informed about the latest trends and breaking news in health. The study, published in the esteemed journal The Lancet Public Health, reviewed dozens of past studies conducted between January 1st, 2014 and February 14th, 2025. The findings are eye-opening. Taking 7,000 steps a day was linked to a 47% lower risk of death, a 38% lower risk of dementia, and a 25% lower risk of heart disease, compared to those who only managed about 2,000 steps a day. But this is the part most people miss. The benefits don't stop there. The risk of death from specific diseases also decreased significantly. For instance, there was a 47% lower risk of death from heart disease and a 37% lower risk of death from cancer. Interestingly, the higher step count showed a non-significant 6% lower risk of getting cancer, according to the researchers. The advantages of a 7,000 step routine extend beyond just reducing the risk of death. It was also associated with a 14% lower risk of type 2 diabetes, a 22% lower risk of depressive symptoms, and a 28% lower risk of falls. These findings suggest that even a modest increase in daily steps can lead to substantial health benefits. But here's the kicker. If 7,000 steps still seems like a daunting goal, even 4,000 steps a day compared to 2,000 steps showed significant risk reduction. Specifically, it was linked to a 36% lower risk of death. This means that any amount of walking you can fit into your day is beneficial for your body and mind. The researchers acknowledge some limitations in their study, such as the lack of age-specific analysis and the small number of studies available for most specific outcomes. However, they hope that the 7,000 step count can serve as a practical public health target. Future studies may delve deeper into age-specific targets, providing even more tailored advice. So, what do you think? Is 7,000 steps a day a realistic and achievable goal for you? Or do you believe that the 10,000 step recommendation is still the gold standard? Share your thoughts in the comments below, and let's spark a conversation about the best way to stay healthy and active. Remember, every step counts, and even a modest increase can make a big difference in your overall well-being.